So SSBCI. Let's talk a little bit
I
about
don't even know what that acronym stands for. Supplemental
benefits.
Senior supplemental benefits for the chronically ill. Is that
For
right?
the chronically ill.
Yeah,
Yes.
chronically ill. Yeah,
Yes,
I know the
she's got it.
I don't know the two S's, but
Yeah. So we've seen the change to this over the last year. So chronic plans are becoming more prevalent out there in the industry. But how you get these benefits, what these benefits are going to give to individuals, and how one plan could give different benefits to one individual versus another,
yeah.
how you qualify for them. All these things are in the new final rule. And we were talking about it a little bit earlier, and it's just fascinating to me. I think if you're an insurance agent, I mean, get ready to take some notes here, because you've got to pay attention to how the changes are taking effect.
Yeah, I'm going to refer to my notes because I want to also preface this with the changes to the SSBCI benefit administration. There are still questions the carriers are going to have. So whether it's their government affairs, their legal, their compliance teams, they're going to still be going to CMS for clarification. So this will be an ongoing understanding, so again, be out there, listeners, make sure you're talking to Pinnacle, make sure you're talking to your broker managers to get the latest updates, because what I'm going to share right now about how this is changing is really high level, but it's really important because I think we all saw the disruption and the trauma of when VBID went away. And so VBID, the value-based insurance design, those funds were what paid for the flex card, right? So that allowed, the food, the healthy food, the utilities, the transportation, and to be able to take that debit card in and use that. And so when that went away, what we saw this year was that SSBCI benefits stepped in. And so for most duals and for all CSNP eligibles, they were able to qualify and still get that flex card, right? So we saw a little disruption there, but I think depending on the numbers, it's 90 to 94% of duals were qualifying. So it wasn't a huge number of people who missed out on those card benefits.
Yeah.
But going into 2027, there are new requirements. So I'm going to just read from my notes so I don't misspeak, but the eligibility criteria is stricter, and each carrier now has to independently verify eligibility. So this is a little bit different. Now, we know some carriers this year allowed for member self-attestation. It's my understanding that that's no longer going to be allowed. So if someone were to say, hey, I start this plan on January 1st and I have type 2 diabetes, that's not going to cut it anymore, unfortunately. Also, chronic condition data alone is not allowed to guarantee that card. So qualifying for a CSNP plan alone is not a trigger automatically like it has been this year. So that's a change, right? And nor are, it's my understanding, still again, got to make sure some of this is confirmed by our carrier partners, but that chronic condition claims are no longer allowed. So let's say you've been on a plan for 2 or 3 years and you have AFib, and that has qualified you as a chronic condition. The plan's no longer going to be able to point to those claims and those diagnoses and say this person has this chronic condition. So there's 2 components going into 2027 for SSBCI verification. So of course they have to be chronically ill, but they have to meet all 3 of these statutory requirements. And I want to preface this again with each carrier is probably going to interpret these statutory requirements a little bit differently. So that makes it fun for everybody, right? So 1, they have to have a medically complex chronic condition. 2, they have a high risk of hospitalization and or adverse health outcomes. So high risk, that's a very vague
statement. Sort of like saying the best plan.
Yes, exactly. And again, it's up to each carrier to determine, does that person have a high risk of hospitalization or adverse health outcomes? And the third prong of those statutory requirements is the member has to have a need for intensive care coordination. Then, by providing that SSBCI benefit, the carrier has to have a reasonable expectation of maintaining or improving that overall health of that chronically ill member. So again, that's going to be up to the carrier to decide if we give them this benefit. Will they, 1, is it going to keep them out of the hospital? Is it going to keep them from adverse health outcomes? Do they need intense care coordination? We know there are people living with chronic conditions that don't need help with it. They've got them managed. They're fine. Fine being a subjective word, but they don't need someone to talk to. They don't need a care manager every week or every month even, or maybe even every year.
Yeah.
Their provider is helping them. They're maintaining their health. So does that knock those people out of eligibility? I don't know. That remains to be seen. But again, then will the benefit maintain or improve the overall condition? Now, here's a couple of other things I want to share. because when you enrolled people for January 1st, again, with the corporate or with the carriers that allowed self-attestation, a lot of times you could have, let's say you enrolled someone in October for 1/1. They could call into that carrier maybe in November and say, hey, I'm type 2 diabetic, or I have ESRD, or whatever their chronic condition was. And then starting in January, they'd have that card available to them. That's not available anymore. Now, because it's not self-attestation, eligibility may be determined prior to their effective date, but how that's going to be done is going to depend on each carrier. There's no more grace periods, though. So it's not going to be automatic. Some carriers gave everybody the card, and then they had to maybe go get a doctor's note to prove that they had that condition. That's not going to work anymore, right? So,
Wow.
And then here's the other kicker, because just when it's getting good, every SSBCI benefit, excluding OTC, so OTC is going to stay the same, has to have its own written policies and eligibility criteria. So what does that mean? Let's think of a common flex card that has healthy food, utilities, and maybe transportation. Each one of those benefits is going to have a separate eligibility criteria. It's no longer bundled together. There's an individual threshold. That is a big burden for the carriers. And so I don't know what's going to happen. My crystal ball broke years ago, but I can imagine carriers, for simplicity's sake, streamlining down to maybe just offering one benefit, because to try to manage that eligibility verification and then be able to be audited later on, if that's were to happen,
Right.
and prove that this person, Rob here, he qualifies for healthy food, but he doesn't qualify for utilities, but Bob qualifies for both.
Right. Two people on the same plan, but one getting different benefits there.
Two
than
people in the
other.
same house, Bob.
Yeah.
I mean, yeah.
So imagine
Yeah.
you as the insurance agent talking about these benefits, talking about you get this, this, and this, but the husband gets all three and the wife gets two of the three.
Yeah.
That is going to be
It's
not good.
challenging to administer that. And imagine the conversation when that individual calls you back and says,
Yeah.
you told me we were getting this. My wife's not getting it now. It's a slippery slope. So to your point, the carriers could very well make it that it's just one benefit that they're getting. Maybe it's the healthy food. Maybe it's
that seems to be that. I mean, that's typically the most widely used. People call it food cards, right? That's
Yeah.
what you hear in the street when we're out in the streets. But so I think that, again, anything could happen. But that would be, if I were trying to streamline something that is this complicated, because again, we talked about this earlier. The final rule came out last week, but bids are due the first week of June. Carriers have a lot of scrambling to do right now to finalize the build of their plans, make sure that they're all ready to go to CMS and get approved. And so adding in all of these additional measures is tough. And I have a couple other things to share. Now, additional burdens on the carrier.
all right, hold on.
Yeah.
Hold on. Let
Do we
me
need to take a drink?
first. This is drink first, and this is not water.
This is
water. The rule is, if you don't know, if you just blow on it, they think it's like coffee.
Oh, yeah. This is water. I'm good. I'm straight and narrow.
I got you. It's water.
So the reason this is important to you as brokers is again, when we talk about the way the administrative work that a carrier has to take on, the cost to them, not in people hours or AI hours, human hours, whatever it is, but also the dollar cost, that affects plans, right? It affects everything that they do. So going forward, again, and this is still open to be finalized due to interpretation, but all supplemental benefits, including those received through a debit and flex card. Now, I interpret supplemental benefits to be dental, hearing, vision. That's my interpretation. So again, remains to be seen, but they have to be included in the member's explanation of benefits, EOB, with a detailed transaction history. Now, think about that. So it's fairly easy, an EOB will show, you went to your PCP, or you had physical therapy, or you had an echo, or whatever. We expect that, and that comes. But now, if you went to a local, drugstore and spent some money and got some vitamins, that's got to be on there now. Now, if you go get a cleaning at your dentist, as I interpret it, that has to be on there now. And that's pulling
It's a
in
little
from
bit
different
cumbersome.
That's
Yeah.
cumbersome. Those are different systems. And think about it too. A lot of carriers are outsourcing. I mean, obviously they have their provider network, but they're outsourcing dental, they're outsourcing hearing. Those are different types of provider networks than a medical provider network. So there's a heavier lift there to get that information into their system, which of course they have because they're paying claims, but then to translate it into their EOB system. That could be cumbersome, right? Another one is that OTC items must be clearly and explicitly evident to all members. So carriers have to publicize a full list of allowed versus prohibited OTC items. Now they kind of do that now. They have their catalogs and things, but at the same time, I mean, we've all heard from seniors or from members who've gone in and said, "Oh, I couldn't get this brand, but I could get this brand," or
Sure.
We've all heard that. So this is going to put additional restraints, I think, on carriers. And I wouldn't be surprised if we see the OTC, again, this is my interpretation. I want to be really clear about that, but I wouldn't be surprised if we see the OTC opportunities restrict a little bit, again, to make that easier for a carrier to manage, because it has to be up to date and available most likely on their website. But again, probably in some sort of written document should a member request that, because we have to make sure that, they're getting what they want.
Yeah.
And then also, in addition to that, SSBCI eligibility and all SSBCI benefit eligibility criteria must be publicly posted. Now, a question I asked somebody was, does that have to be posted by 10/1 or 1/1? And they weren't sure. So again, we'll hear from our carrier partners, but that'll make a difference to you, all of us, really, because if it's not publicly posted by 10/1, if they don't have to, it'll make it a little more complicated when you're having those conversations with your clients about, hey, you may or may not qualify for this card. But I think my main takeaway from this, and it's going to be an adjustment for our DSNP, our low income, and our CSNP members, is we've got to stop leading with the card, because you can't guarantee that whomever at any carrier is looking behind the scenes and interpreting data that you're never going to be able to have access to because of PHI. They're not going to give you that claims data and say, well, Mrs. Jones had this happen on X date, and this is why we determined she did qualify, while her husband doesn't. They're not going to give you that, and you're not going to be able to answer your member. So
that's a big challenge, because I mean, nobody wants to have the negative experience for the beneficiary, because it's going to lead to unhappy individuals. You're going to lead to complaints and all these other things that are just going to be adverse at the end of the day. And then getting the individual into the right plan at that point, when it's down the road, how do you figure that out?
Not to mention, might be cause of so many divorces if the husband gets an extra thing that the wife doesn't.
Yeah.
And I mean, but I know I'm being funny, but that causes turmoil in the house. I mean, just the trickle down effect of, I mean, think about it, right? How did they determine all of these little rules and regulations without pulling back?
Yeah.
I mean, the accounting that they would need to get this stuff on the EOB, which, I mean, stands for explanation of benefits, by the way, just so if you're new to this and you're hearing it, which we've all gotten at some point, but like, how do you dictate that? Right?
Exactly. And
logistically, think about what they would have to do. It's the same thing with the, call recording logistics, right? It took that 2 or 3 years, and it's still kind of funky, right? I mean, I don't know how they're going to do it, but I think just like, all the changes with Part D over the past couple of years, at the end of the day, it trickles down to the members, and the members are the one that really gets hit the hardest.
Absolutely. And so I think the important takeaway here is, as you're building your business plans, once you get your plan details and what's going to be available in your market, a lot of times when you look at your DSNP and CSNP members, one of the top things you would lead with is X amount of dollars on this flex card. Yeah. That's no longer a guarantee. And so you really want to think about how you're presenting and positioning plans, and really get back to the old school days of, guess what? This is why this is the right plan. This is why this is the best plan for you. And it's not because you may get this dollar amount every month. Now, everyone's still going to get OTC, who, if the plan has it, that's not part of those SSBCI qualifications. But I mean, frankly, I don't think anyone is choosing a DSNP plan these days because they're getting, $400 a month in vitamins and sunscreen. It's because it's going to help them take care of some of those, social determinants of health needs, like their utilities and their food. So you just want to start thinking about, how would you position a health plan if the food card doesn't exist anymore? How are you going to sell that? And how are you going to say this is the best plan for you, with the assumption that that person may not qualify? And that's a big change. And I think it's really important brokers start thinking about that now. Obviously, if you're selling now into lock-in period and you've got SCPs, you've got aging in, you could still talk about it. You should still talk about it, but it might even be a fair warning to start to say to your patients, our patients, your members, this could change. May not, but ultimately the broker's not going to be able to explain why.
Yeah,
And
it's a big deal. You know, we're talking a lot about these changes, and I think a really important point is that the carrier interpretations. We're going to have to wait and see some of that before we can really kind of scope out how this is all going to work. At the end of the day, right now we're sort of digesting this info, but there's going to be a lot to take into account over the next several months.
And I do want to say too, hopefully, the carriers, obviously people who have legal minds and compliance minds, it may not be as harsh as it sounds right now, but I think it's important for us to think about it at this level and hope that it's a better outcome, because we need to be prepared. And if it turns out that it's easier, that they've figured out a couple of blanket eligibility things that are going to solve for some of the plans, again, they're going to hear back.
Right.
They'll know this. We're still in very early days, but I think it's really important to just have this on the radar, to start thinking about how you would present to patient or to members if this wasn't available. It's not a guarantee, because there will be changes regardless. It's just we don't quite know the ripple effect of how that's all going to lay out. And again, to like Rob said, it's every carrier is going to be different, so that's going to require that deep dive education, because one carrier may do it quite differently than another.
Yeah, Rob, a lot of webinars we hold, a lot of trainings we hold. We'll continue to do that. You got to just make sure, just follow, keep an eye on emails that we send out. We'll figure out each of the carriers and what they're doing. We'll get the experts on and give explanations, and we'll have it mapped and planned out, right? The best that we can, right? From the carriers, and we'll know how each one is doing, all these different things. So you just got to keep an eye on everything and make sure we set all this stuff up.